Hello, my name is Tomatero. Today I'll be talking about Carlos. Carlos is a 5 old month baby that was recently diagnosed with Plagiocephaly, and he was brought in by his parents, and their concerns are sleeping and feeding. So right off the bat, there are two occupational performance concerns: are feeding and sleeping, due to the fact that in feeding he has lower jaw and uneven cheekbones, and been he has have a difficult time swallowing. So that's why they're concerned about feeding. And sleeping, because he has been laying in the same position. So now we have to create a new pattern, a new schedule for him to lay in different positions, and it might be difficult for him to get accustomed to it, since he has been just laying down most of the time. His strengths are play and participate in age appropriate activities, and he's socially engageable at the time. So three underlying factors for the diagnosis are his tilt, because of the position of the skull. His head tends to tilt to one side. Also, torticollis, shortness of the muscles on the neck, and also uneven cheekbones at the time. So these are gonna be our main underlying factors and characteristics of Plagiocephaly. The two frame of reference that I picked are developmental, due to the fact that the child is not developing correctly at the time and not meeting his milestones due to his diagnosis. So he's having difficulty, feeding, sleeping. Those are very important occupations at the time. Also, he has been difficult having tummy time. So those muscles that he should be hitting at the time, he's unable, because he's not developing properly. That's why I choose the developmental frame of reference. The other frame of reference that I choose is the motor skills acquisition, and this focuses on the emphasis on the person task environment, and it focuses on functional tasks and the active role on the learner, meaning that we are gonna focus on the tasks that he's able to perform, and then the ones that he cannot perform, and we got just gonna go in. We're gonna focus on the patient, the task at hand, and the environment. The assessments that I chose are for top-down assessment is the PEDICAT. The PEDICAT is a test that is basically a parent questionnaire, because at this time we cannot question or ask questions to the child what is his concern and what he should be working on, and the goals that he wants to do. So right now we're gonna do the PEDICAT for the questionnaires to interview the parents. My button-up assessment will be the Peabody. I'll be assessing all the skills that he should be doing at the moment, and I'll also be assessing other skills that are not appropriately on the Peabody. We'll be doing positioning, sitting. Those are the main ones at this time to perform, to know these skills. The two occupation-based outcomes based, on the case, Carlos will be able to complete feeding activity with minimum spillage, and he also will be able to sleep independently without any schedules or change of positions after time. So my two goals that I created are, Matt will improve time spent sleeping from 2 hours with physical assistance from caregiver by following a positioning schedule in 2 months. So within the 2 months, we will be able to implement this schedule, and he will be able to sleep in different positions within the 2 months time frame. The other goal that I created is Matt will demonstrate functional oral motor skills as determined by occupational therapists in order to eat an age-appropriate diet within 2 months. So we are gonna work on his oral motor skills to increase those and bring them to age appropriately, and then work our way around foods after that. And the goals are going to be measured every week to demonstrate progress within the goals, and we'll be measuring, and this will measure how much time he's sleeping, or how much he's eating or what he's eating. Is he able to swallow better? And other occupations that are also he is struggling. Thank you for watching this video. I hope it was helpful.